It's my great privilege now to ask you to welcome Task Force President and CEO, David Ross.
Get this right. Well, thank you, Sally. Thank you so much for a very kind introduction. Thanks to all of you for being here and for contributing to really thought-provoking discussions yesterday and today. Peter, Maggie, the board, the jury, we thank you. Zainab, for your lunch talk, it was absolutely inspiring. And it brought back to me a memory I had in the early 2000s at a refugee camp in Zambia, where as the sun was setting late in the day, we were visiting refugees who were internally displaced because of the HIV/AIDS epidemic. And I knelt down with this little boy who came running up to say hello. He was probably 4 years old, I'm guessing. Was naked. He didn't have clothes even. But as I knelt down to say hello, what I saw was that by kneeling down and looking at him eye to eye, and we were at a water kind of faucet there in this camp and helping him with the water, it was talking to him, asking his name, endorsing him, and dignifying him as a human that really made the difference. And I realized, Zainab, what you said today is absolutely true. We are about building dignity. So thank you for your remarks. I want to thank the Hilton Foundation for honoring the Task Force for Global Health with the 2016 Conrad N. Hilton Humanitarian Prize. We are humbled. This is a word we've heard a lot today, but it is absolutely genuine. We are humbled by this extraordinary recognition. And Maggie, like you, I stand in awe of all the speakers we've heard today. This is so enriching. Thank you. We celebrate today more than 3 decades of contributions to global health, and there are many, many people who've made this honor possible. We saw the movie, so thank you. There are far too many to name, but there are a few who I must call out. So I will start with Dr. Bill Foege. As you saw in the video, he, along with his colleagues Bill Watson and Carol Walters, founded the task force based on a model of collaboration to solve large-scale health problems. I would also like to and must recognize my immediate predecessor, colleague, and friend, Dr. Mark Rosenberg, who led the task force to become the organization that we're celebrating today. So I have the good fortune of having been CEO for 5 months, and here I stand giving this speech. These 2 gentlemen should be here speaking. I also want to thank our board members who are present here today, Carol Walters, Jane Thorpe, our board chair, Pete McTeer, and Dr. Jim Curran. And I must also offer a very special thanks to Jane. I think she is the model of what is the very best in a board chair for an organization like ours. I also want to recognize and thank Dr. Howard Hyatt, who's not here today with us. He is the Dean Emeritus of the Harvard School of Public Health, and it was Howard who nominated us for this award, so thank you, Howard. Finally, I'd like to recognize our staff, some of whom are here today, but staff both current and past. A number of them, as I say, are here. These are people who are some of the best minds in public health, definitely some of the most generous, caring, and compassionate spirits. So for those of you on our staff who are here, would you please wave your hand so people can look around and see you? Thank you. So the task force is, at its core, a group of people dedicated to the very enormous task of improving the health of the most vulnerable and marginalized people in the world, many of whom who live in poverty. We know that good health is a challenge for the world's poor who struggle to meet the basic necessities of life, including access to adequate food, clean water, and basic health services, including vaccines and medicines. Poverty puts people at greater risk for a host of diseases that have long been conquered in other parts of the world. These diseases cut lives short and cause untold suffering. But they do more than that. They burden people's health. They take away one's ability to take care of their families. They rob children of education and therefore hope for a better future. And ultimately, they help trap people in cycles of poverty. At the task force, we don't accept the inevitability of these diseases. We see a world with resources and expertise that can prevent and control and eliminate them. So then how do we connect the solution with the need? So we've recognized that complex global health problems are too big for any one organization to solve alone. Solving them requires collaboration and collaborative efforts of many organizations, often across multiple sectors. So this has been our approach to addressing global health challenges for more than 3 decades and will continue to be our practice going forward. Our work is rooted in a belief that all lives have equal value and everyone should have access to the means for good health. It's not enough to simply believe that. We are compelled to make it happen, and that is what we call consequential compassion. So as we gather in this elegant ballroom today, we know that if any one of us has an emergency, medical care is just around the corner. Medical care is available. You can even go to the CVS on the corner and get your seasonal flu vaccine. We have access to health care and vaccines and medicines. Across the country, we are also protected by public health systems that can respond to disease outbreaks and other health threats. But that's not the norm in the rest of the world. The world that the task force serves is different than the one that we know here. A group of infectious diseases called neglected tropical diseases that are virtually unknown in the U.S. plague the world's poor with blindness, disfigurement, cognitive impairment, and even death. Due to the lack of vaccines, influenza kills up to 500,000 people every year in low and middle-income countries. Our goal is a world where neglected tropical diseases are no longer health problems and everyone has access to vaccines and essential medicines. So I'd like to share 2 examples of how our work is changing the picture for health of the world's poor. In Ethiopia, which has the world's highest rate of trachoma, this disease has sadly been accepted as a part of life in rural parts of that country. In fact, some people consider blindness a normal part of aging. Imagine thinking that if I live long enough, I may become blind. So the means to eliminate this terrible disease is available today. And thanks to our pharmaceutical partner Pfizer and other partners, trachoma will hopefully be eliminated in Ethiopia and in other countries in a few years. At the task force, we work with countries and partners to implement large-scale, multi-sector programs to eliminate trachoma. This includes then supporting the mass drug administration with antibiotics donated by Pfizer. This year alone, our collaborative efforts will provide treatment to more than 100 million people threatened by trachoma. So this is a very massive undertaking, And it is possible only because of the kind of collaborations that are built and sustained. We've also been working on polio eradication for a number of years. While eradication has taken longer than initially expected, the number of cases of paralytic polio has declined from 1,000 every day in 1988 to just 26 cases total so far this year. The disease now exists only in a handful of countries, and hopefully it soon will also be wiped off the face of the earth. We recently supported the worldwide switch to a safer form of oral polio vaccine, which is one important step towards eliminating polio. Earlier this year, in a period of less than a month, 155 countries switched to this safer form of vaccine. This was really unprecedented in the history of the world. So we learned a lot from this experience. We learned that you can address a big problem with many countries. We know now that with a lot of preparation, it is possible for 155 countries to work together on a single health issue in a short period of time. It is possible. This experience also speaks to the potential for collaboration for addressing other large-scale humanitarian issues like refugee crisis. As was said earlier today, we know that conflicts, climate change, and natural disasters are going to result in mass migrations in the future. So I think it will be critical for us to think about how we can plan ahead to address events before they occur. In his book, my colleague Dr. Mark Rosenberg boils down effective collaboration to three main elements: identifying the problem, bringing together the right partners, and implementing an effective, sustainable response. We know that a robust response to refugee crises must involve multiple parties working together in a coordinated manner for a long, prolonged period of time. Our experience in building coalitions that have staying power, and I think I have to underscore that part, that have staying power, tells me that a crisis is not the time to hand out one's business card. It's not the time to try to get to know your partners. We can plan in advance. We need to develop coalitions now that prepare for response. We know that success from public health preparedness in the United States, that it is possible to predict where and when to respond. We can pre-position medicines and medical supplies and vaccines around the world for rapid response. This was discussed this morning. Public health also has the tools needed for identifying and tracking displaced people, which is going to be needed to handle mass migrations. Right now, several of our programs are using inexpensive and flexible smartphone technology to collect a variety of health information from populations and in countries around the world. These systems could easily be adapted for use in refugee crises. We can expect refugee crises to be accompanied by infectious disease outbreaks. Again, we know this is going to happen. To respond to these contingencies, we will need basic public health surveillance that includes trained frontline workforce and the requisite tools for detecting and responding to outbreaks. I think done correctly, we can design and prepare coalitions and core public health responses today that will be needed in the event of future refugee crises. In our work, while we help countries control and eliminate diseases, we can also build critical infrastructure necessary for strong and sustainable public health systems. And I know that many of the laureate organizations represented here today would join me in saying, yes, we can join together and plan ahead and mitigate some of the challenges that we see today. So these include logistical systems to deliver essential medicines and vaccines, disease surveillance systems that also include training frontline workers and how to recognize and manage disease outbreak response, and of course, human resource information systems that enable countries to manage their workforce effectively. So this will be our lasting legacy. sustainable public health systems that can respond to issues from within rather than relying totally on external resources and personnel. Earlier, I mentioned the concept of consequential compassion. It's not enough for us to feel something needs to be done to alleviate suffering and disease and childhood mortality. All of us in this room and many, many people around the world feel that way. At the task force, we believe that we have a responsibility to act, to help those most in need. That is our mission. It is to act. So, as I close, you may be asking yourselves, what are we going to do with this wonderful prize money? As I've said to all of my colleagues, I really didn't expect this. This is a very lovely problem to have to deal with, but not one I thought I would be dealing with. Because of our unexpected and somewhat unprecedented growth in the recent years, due to the success of our programs, we have to acquire more space in Atlanta, where we're based. So we'll be using the Hilton Prize money to help us purchase a new facility. That new facility will help us unlock our capacity to help more people. We also see this as a facility serving as a new hub for global health in the Atlanta area by bringing together organizations who together with us can help solve complex problems. The additional space also gives us the capacity to move into other areas of global health need, particularly non-communicable diseases and injuries. So where we know there is a huge and growing demand for our services and the kind of help that we can provide in building coalitions. Dr. Faggy speaks frequently about the optimism for future of global health. Our own future has never been brighter. So I will close with a vision of the world as we think it should be. This is a vision where it's a world where all children receive necessary immunizations. It's a world where every community is protected by public health systems that can predict and detect and respond to health threats. And it's a world where all countries can meet the needs of their populations. So that's a nice vision. We're not there and not going to get there anytime soon. But we are optimistic that we will keep working at this. Ultimately, we're trying to work ourselves out of a job. Our goal is to help those who can help themselves. And when they can do that, we can turn off the lights and go home. So on behalf of my colleagues, past and present, we are humbled and incredibly appreciative of the acknowledgement that the Hilton Humanitarian Prize affords us and bestows on us. This recognition emboldens us with confidence to act, to do more, and to do more sooner. You've helped set us further down the path. We thank you very much. And we will be thrilled to join the coalition of laureate partners. Thank you.
So Dave Ross and all of your colleagues, past and present, it's our honor to present you with the 2016 Hilton Humanitarian Prize and to welcome you into the laureate family. Thank you.
Thank you very much. Thank you.
Pleasure.